Hey, it's Dr. Steve here. Today, in this video, we're going to be talking about the most frequently asked question that I get as a chiropractor when someone begins care in the office, and we're talking about sleep. So yes, super important topic today, sleep. How do I sleep? What's the best way to recover, to get restful sleep? So the best position to sleep on is either back or side sleeping. I don't recommend at all stomach sleeping. And I know, I'm sorry for all you people who love to sleep on your stomach. It does mess up your neck. You have to be able to breathe at night. Okay, so if you're on your stomach and your head is turned, that's between 6 to 8 hours that your head is turned, and you're probably gonna end up with a neck problem. So it's not supportive of recovery at all. So get comfortable on your side, get comfortable on your back. Just have to make do with that. If you're on your back, you want something low and small, but also you want it to support your neck curve like this. So you want it to be able to fit inside the neck and then still support that curve, allowing your head to come back. You don't want 3 pillows where it's pushing up and your chin is touching your chest when you're sleeping on your back. I know it shows it in sitcoms, and do they even have those anymore? I don't know. In television shows, in movies, that people are way propped up, but that's a terrible way to sleep. It will give you neck problems. If you're on your side, you want something wider, because it's got to support all the way through the span of your shoulder up to your ear. So you don't want like a small roll to be laying on your side. A lot of people have like a curved pillow. Unfortunately, what I've found is that those oftentimes will not be able to serve very many people, because everyone has a different size and different shape. And that pillow is just kind of a one size fits almost none. And so the only way I recommend having those curved pillows is actually if you flip it over and you have the flat side up and you put the large portion in your shoulder. Now if your frame is smaller, you can actually use the smaller side, but still you want to flip it over so that the flat side is against your ear as you're laying on your side. Now if you're on your back, sometimes those curved pillows are good. But what I found is that oftentimes they won't really hit you right to support the neck curve. Every once in a while someone will get lucky and have one that supports them right, but unfortunately those curved pillows, good in theory, but unfortunately they just don't work most of the time. So I'm going to show you the pillow I recommend. I recommend this pillow for back sleeping as well as side sleeping, and it's one pillow. So usually people will need 2 different pillows unless they buy a specialized pillow like the one I'll show you. And the back sleeping, you want something that supports your neck curve. On side sleeping, you want something that spans the gap and is a bit thicker. Okay, so let's take a look at this. So for example, this portion is where you would sleep on your side, and then this portion would cradle your head while at the same time supporting the back of your neck and the neck curve. Okay, and so it does take some getting used to as you in this pillow, you'll actually travel from your back over onto your side. Most people, when they roll over, they roll in place. And so this is a little bit weird getting used to at the beginning, because you go from your side and then you roll up onto your shoulder. And so after you get used to it, it's fantastic, because then you don't have to carry 2 different pillows if you go from back and side. Like I said before, so back sleeping is recommended because it supports the neck curve. Side sleeping is next best. I don't recommend stomach sleeping at all. Okay, let's talk about the next portion, which is your legs. What are you going to be doing with your legs? All right, so when you're on your back, you want something behind the knees, and that's to create a little bit of flexion in the hip joint. Because if your legs are flat, your hips can pull on the low back and it can actually create problems. So that's back sleeping. You want something supporting just slightly under the knees so that they're slightly bent. If you go side sleeping, you're going to want something between the knees. And that's so that your hips can stay balanced as something is pushing the knees apart. Otherwise, a lot of times people will do this and it'll pull on the hip. Or if there's no pillow here, this hip will drop and then it'll pull on whatever hip is on top. And some people will create hip problems because they're not supporting their knees and having something in between. So this is the way I recommend side sleeping, having a support. And then also back sleeping, also having a support like a body pillow is great. So sleep is one of the most important things that we'll do, because we spend so much time doing it. Make sure we do it well. Support your spine and your nervous system while you're sleeping by sleeping in the proper position and with proper supports. And then make sure that your spine and nervous system is in proper alignment through chiropractic throughout the whole process. So if it's been a while since you've been checked, it's time to get in. If you're currently getting checked, awesome, you're probably experiencing great sleep or on your way to that. And so we'll see you in the next video.